My name's Karin Peterson. I'm a social worker and I've been at the Cradle for 21 years. I've done a lot of different things over the years, but currently I work in community outreach and education. So as part of our mission to bring adoption education out into the community, we're really focused on the hospitals, making sure that hospital social workers and nurses, physicians, nurse case managers, making sure they have accurate and complete information about how adoption works today. Well, one thing that I think really is important for hospital social workers and nurses, case managers, is for them to be aware of local resources available to their patients. So as opposed to giving a patient a list with 30 licensed agencies, be prepared with a shorter list of adoption resources really known to the hospital to do excellent work, where the professionals have had excellent experiences with that agency, and most importantly, where the patients have been well served in the past. The first thing that would happen is the hospital nurse, if it's the nurse that she told first, would let the social work department know that the patient is thinking about adoption. And what the social worker would do, in addition to offering her support, is give her a list or possible ideas for an adoption resource for her to reach out to so that a counselor could come out and meet with her in the hospital. What that social worker will do, in addition to gathering information about the patient's situation and learn why she's considering the option of adoption, she'll also be giving her information. So educating her about how adoption works, what are her choices, how involved would she like to be. Well, one thing that often surprises people is to learn that fully 30% of women who contact the Cradle or who look into the option of adoption have not found a resource or talked to anyone about their possible interest in that option. So once the baby is born, the very first time they may say the word adoption out loud or ask anyone for information is right there in the hospital. So it's so important that people are prepared with information to share with that patient, and also to begin to imagine what might be going on for her.